Last year in 2018, many people had significant difficulties in accessing home support services, particularly elderly people and those being discharged from hospital. My question is very simply, what level of provision of home support services are you making available for this year, 2019, recognising that last year there was a constant significant waiting list for that service?
Deputy Minister, please.
Thank you, Deputy. Home support is an important support that enables older people to remain in their own homes and communities for as long as possible. It also facilitates timely discharge from acute hospitals. As a government, we have made improved access to home support services a key priority. Over the past 4 years, we have seen a sustained investment in these services, with a considerable increase of nearly €140 million in the budget, which has grown from €306 million in 2015 to almost €446 million this year. The HSE's National Service Plan provides for a target of almost 18 million home support hours to be provided to 53,182 people this year. So that's the answer to the Deputy's question, 18 million home support hours to be provided to, and that represents an increase of some 800,000 home help hours and home support for 2,682 more people over last year's target. In addition, 235 intensive home care packages will provide 360,000 home support hours for people with complex needs. Despite this significant level of service provision, demand continues to rise. While the existing home support service is delivering crucial support to many people across the country, it needs to be improved to better meet the changing needs of people. That is why we propose to establish a statutory scheme for home support which will improve access to the service and put it on an affordable and sustainable basis, while also introducing a system of regulation that will ensure public confidence. This is a significant and complex undertaking, and the Stand Care implementation strategy commits to the introduction of the statutory scheme in 2021.
Deputy.
Thank you, Minister, for your reply. And I acknowledge the increase in figures that you've outlined. I suppose it's fair to say that last year was problematic. It's an indication that we have an ageing and growing population. And certainly, most public reps would have had an increased number of people presenting at their offices looking for support. Now, you've indicated that there are 53,000, there will be home support services for 53,000 people. Last year, the budget was for 50,000, I think 500, and most times we asked questions, there were 52,500 people in receipt of service. But at the same time, Minister, there were 6,000 or 7,000 on a waiting list. So if you put the 52,500 with the 6,500, there were 58,000 or 9,000 people looking for for home support services at any given point in time. And I'm asking you specifically, making 53,000 available, is a service for 53,000 doesn't seem to be sufficient to meet the current need. And I'd ask you to look at that in context of the constant demand last year, where hours were being recycled, where hours were being diminished for people, and the problem, particularly for elderly people who were in hospital to try and come home, wasn't being met by the number of hours that were being made available.
Be the first to acknowledge that we won't meet the targets that are going to be there this year. Not those targets, but the demand that is going to be there this year. We just will not. We don't have an infinite budget. The many competing things that we talk about across this floor all day, every day, whether it's more pay for the nurses, whether it is the drugs that we want to see approved, whether, there's so many competing budgets. This is just one more cog in that wheel. 140 million is a very significant increase by any standards over a 4-year period, and it has allowed an increase of 800,000 home help hours this year. But I can categorically, regrettably state here, we will not meet the demand that is there for home help this year, and there's no point in I pretending to dress that up in any other way. And you and I will have this conversation, I'm sure, for another amount of time during this year, and debate it many times during leaders' questions. But the reality is we do have a finite budget, as we do in all the other areas that the demands are increasing, and that's why we've undertaken to do a statutory home care scheme where we can actually provide to everybody, and that's an ambition we have by 2021. And a significant piece of work has been done even by the Health Research Board, looking at Germany, looking at Sweden, looking at Scotland, looking at the Netherlands, where they have similar schemes in operation, and we're trying to build a scheme along those lines. That's a complex challenge.
Minister, I recognise the fact that you don't have an infinite budget and you have to work within constraints, and I think in that regard we need to look at how things are done. But for somebody who is on a delayed discharge from a hospital, there is an opportunity cost. There is an actual real cost there. Secondly, I noted, because I'd asked a previous parliamentary question and got a response from the HSE, that the number of direct employees to the HSE providing home support services is reducing. The dependency on agencies to provide this type of service is increasing, and I would like to ask you, do you believe that's the best value for money, where rather than direct employees? Is there scope to examine that to increase the capacity? And specifically, Minister, my own area, which falls under CHO 7, something peculiar has been going on and needs to be addressed. In March of 2018, there were 724 people waiting for home support services. By August, that figure had gone up by over 50% to over 1,100 people, out of kilter with all of the other figures. And I don't expect you to have the response, but I would ask you to look at it directly. But in terms of cost saving, I would ask that an analysis be done between using agency staff for the bulk with a diminishing HSE direct employees, which had been the previous model. And would that be a source to provide additional hours?
Minister, your final reply.
And Deputy, of course, we will try and get the best value for the limited budget we have, and that's the point you're making first and foremost, and that we have the better utilisation. But I'll be honest with you, I haven't put an awful lot of focus into managing the existing system, and neither have I directed an awful lot of my officials to spend time with that, because I can start thinking around the edges with the existing system, and we have issues with training, with regulation, with the supply, with the postcode lotteries it's referred to. There's a myriad of challenges in the existing system, and I have taken the political decision to move away from that and try and just develop from the ground up a new system fit for purpose that will address a lot of these issues collectively. I will certainly look at your own area there, the disparity that you've asked. That would seem unusual, that it would jump 50%, particularly in those months. My job as well, Mr. Harris, has asked me to chair an implementation body on delayed discharges from hospitals, so it's an area I have a particular interest in. And I absolutely accept, of course, the financial point you make, that you can save a pound, but be penny wise, pound foolish, whatever that saying is, that there is a cost basis as well to this, and we will be looking at that, of course, at all, and I would be very keen focus on that, having responsibility for the home care service, and also with a view to tackling the issue of delayed discharges in the acute hospital system would continue to be something I would have focus on. I will come back to the Deputy on his local query about his local area.